their lived experience. Oh, we're recording, great. To share their lived experience, what they've done with advocacy, and what we can do again all year long to support New Hampshire's LGBTQ plus community in New Hampshire. So I'm going to get started by introducing our attendees. Again, it appears that everyone is on mute, but as you're joining, it looks like some folks are not. So if you can please just remember to mute yourself, we would appreciate it. So our first panelist is State Representative Jerry Cannon. Jerry, if you want to wave so people can see you in the gallery. Jerry currently serves as a state rep for Somersworth and Rollingsford. She began her political career in 2017 when she was elected to the Somersworth School Board for 2 terms. And in 2018, she was elected to her very first term in the New Hampshire as a New Hampshire state representative and was reelected in 2020. Jerry is a leader in New Hampshire's transgender community and has been educating people about concerns of that community for the last 20 years. And has spoken at several events for PFLAG New Hampshire, Freedom New Hampshire, the New Hampshire Conference of UCC Churches, as well as in the New Hampshire State Legislature. So wave again one more time, Jerry. And if I miss anything in your bio that you'd like to contribute, feel free to jump in. If not, I'm going to move on to our other esteemed former representative, Ed Butler, who also happens to be New Future's 2020 Legislator of the Year for some incredible work that he's done in his time in the legislature on issues related to access to healthcare and prescription drug pricing. Ed runs the Notchland Inn with his husband and Crawford Notch. His first career was as a nurse and a long-term care administrator in New York City, part of which was during the AIDS crisis. He also serves had served as the chair of the House Commerce Committee, which is where we had our most interactions and most lively interactions with Ed. He co-sponsored, again, New Hampshire's marriage equity bill and was the prime sponsor for gender non-discrimination bills, among others in the New Hampshire State House. So we're pleased to have Ed joining us for this conversation. Ed, if you just want to say hi so people can see you.
Thank you, Michelle.
Our next panelist is Alyssa Antman from Planned Parenthood, Northern New England. Alyssa is a public affairs organizer with the Planned Parenthood New Hampshire Action Fund. She has a background in social work and public health, is dedicated to protecting and expanding access to affordable care in New Hampshire. She previously taught health education courses in Boston high schools, advocating for mental health, consent, healthy decision-making, and worked for Prevention Innovations Research Center in preventing and raising awareness of domestic violence and sexual assault. Currently, she's working again for Planned Parenthood of Northern New England in an advocacy and grassroots organizing capacity to make our communities stronger and healthier. So Alyssa, if you don't mind, again, waving. And our next panelist is Carlos Cardona, proudly a community leader within the Lakes region of New Hampshire, serving with Laconia City Democrats chairman, and as a member of the Belknap Democrats, and also as a member of the Latino Democratic Caucus. He is an outspoken advocate for LGBTQ plus rights, a proud native of Puerto Rico, and an alum of AmeriCorps. He lives with his partner and 2 children in Laconia, and we are happy to have Carlos joining us for this conversation. Carlos, do you mean saying hi? Great. And our last panelist, last but not least, we have Finley Allen. Finley is a transmasculine person from Concord who loves to create art. He graduated from Concord High School in 2020 in the middle of the pandemic. Will be attending college this upcoming fall to become an occupational therapist. During his senior year of high school, he served as the president of Tide Pride, his school's gay right alliance, and was a finalist for New Future's 2020 Magnify Voices Expressive Art Contest. And we are actually pleased to be able to insert a link in the chat so you can see the artwork and the poem that Finley put together for that contest. I encourage everyone to go through all of the submissions, but Finley's is particularly powerful, so we wanted to make sure that we had shared it with all of you. So why don't we go ahead and jump right in to our first question. So all of our panelists and many of those in attendance, I see several familiar names in the list of attendees. You know that New Futures advocates for affordable access to healthcare services for all grant staters. This includes mental health services, youth behavioral health services, evidence-based prevention, treatment and recovery programs. And we also know that folks within the LGBTQ plus community have historically experienced barriers to receiving these and other healthcare services that they need. In your experience, and anyone can feel free to jump in and take this, what has been the most important or salient issue impacting LGBTQ plus individuals regarding health in New Hampshire today?
Well, I guess I'll jump in if it's okay.
Yeah, go for it. Thank you.
Thank you for having me. It's so great and an honor to be amongst all these amazing leaders across the state that inspire me every day. But I do think that the biggest barrier is mental health is very important. Oftentimes, like in my community, you might come across mental health providers that have religious biases who oftentimes end up discriminating against the LGBTQ plus community. And so that's been something that has been on my mind as from a very young age. It is tough enough already to come out of the closet, but from a very young age, experiencing my first boyfriend committing suicide, I just realized we already have enough obstacles. So encountering these in the mental health is just an extra barrier that we don't need in our community. And when we have legislators in the state house making more barriers for our community, it's even more difficult to find the help that we need. And finding doctors that are just either bilingual, because our community is just as diverse as any other community. It's also something that we encounter often. So oftentimes our community is not able to get the health checkups that we need because we encounter those barriers. So to me, that's something that it's alarming in the state of New Hampshire, and then it's increasing as our population is growing and as our population is becoming more diverse. I look back 15 years ago, me remembering not seeing many Hispanics in this state, and now seeing the population growth, it's concerning that our LGBTQ community will continue to fall behind because we don't have, our needs are not being met in the community. So that's my 2 cents on that.
Thank you, Carlos. Jerry, I'm sorry, Representative Cannon, I saw that you had taken yourself off mute. Same with Ed. Feel free to jump in.
I was going to say healthcare providers in general who are knowledgeable about our community. As a transgender person, when I was first coming out, trying to find an endocrinologist that could help me here in the state was incredibly difficult. And in the process, I educated 3 endocrinologists myself on what my own care should be. And it's getting a little better, but it's still not throughout the state to help a transgender person in their endocrinology needs or surgical needs or anything. It's just been very difficult. And to top that all off, there are very few therapists, as Carlos was talking about, that will accept Medicaid. Medicaid doesn't, it doesn't pay well enough for a lot of physicians to accept it. So that's one of the things we need to improve in Concord is to get the Medicaid payments up. Yeah, those are biggies. And,
yeah, those are great points.
So.
And thank you, Carlos and Jerry, because you are hitting several nails on the head. My theme, I think, in this conversation is acceptance, acceptance, acceptance. We have come such a long way. For those of us who are older here in this group, we have seen an incredible opening up of understanding of LGBTQ issues. I'm for this month reading a book called The Deviance War, which I commend to all of you. It is a really good history of some of the early struggle, but not early meaning the 50s and 60s, not before that. But I am older than many here, and certainly the oldest member of the panel. And I'm glad to see Martha McLeod here, because I think one of the issues that is going to become more important is how do we get healthcare, and how much healthcare support do we get as we age. Many LGBTQ couples or people don't have the family support, either because they don't have kids. At least in my generation, it wasn't usual for us to have kids. Although I think if I were young now, I might be doing that. But I think one of the concerns is going to be supporting our community as we age, and getting the appropriate support if we need to go into long-term care facilities. And as you said, Michelle, in your opening remarks, affordable access, and affordability is also a bottom line issue across the board when we're talking about healthcare, because some people have the ability to afford it, can get access, but those who have more challenges in terms of affordability don't get the same kind of access and the same quality of care.
Yeah, that's 100% true. We've said at New Futures, as part of our advocacy around access to affordable healthcare, that having an insurance card in your pocket is helpful to some extent, but if you can't use it to access the care that you need when and where you need it, that's culturally competent and linguistically accessible to you, then it really is meaningless. It's a piece of paper that you can't use. So you're hitting on a lot of trends and I think key points here around what is true access to services and how are we quantifying that, and how are we accounting for, or really not accounting for, the needs to access for certain communities, and making sure that those that are responsible for providing care are doing so in a responsible manner. So again, great points. I would expect nothing less from you, Ed. Finley, Alyssa, anything that you'd like to add to this conversation?
Thank you, Alyssa. Probably as I was hearing everybody talk, the key points that kept on popping up in my head would probably be from my own experience. So the endocrinologist that I went to in the beginning, and then the second endocrinologist, and then my surgeon for my top surgery, all had very specific ways they wanted me to be, and almost like this cookie cutter mold that they wanted for a trans person. And as someone who falls under that spectrum, they wanted me to fit into that. Okay, I need to hit all of these marks in order to even start hormones. And probably the biggest thing, or the biggest hurdle that I had to jump over, I guess, would have been that they weren't as open-minded. They just had this idea in their head of what a trans person should look, act, and think like. And if you didn't fit in that mold, it would be even harder for you to go on hormones, have top surgery, or have bottom surgery, really anything. And that is something that I personally have experienced and would feel really needs to change, and change for the better, really.
Thanks, Tim. Alyssa?
Those are some tough acts to follow. I just want to echo everyone in the room, just especially that culturally competent, accessible, affordable healthcare, which is just one of the biggest issues right now, because we're seeing such, and I'm speaking from my organizer hat from Planned Parenthood, we're just seeing such a massive underfunding of family planning program and public health across the state, and so many attacks on healthcare and reproductive rights, kind of from my lens, but especially with the state budget that we're just seeing as passed on Friday. We have 11,000 patients that rely on critical access to care that are going to be affected by this budget, and especially hitting our LGBTQ AIP plus folks even harder. Thinking about, that there is a huge STI crisis in New Hampshire as well. There's a lot of underfunded public health programs. Mental health has taken such a hit as well. And I just think about the importance of that culturally competent care. I think, for me, when I first walked through the door of Planned Parenthood, the first thing I saw on the door was, at Planned Parenthood, I know that I'm not the first queer person that's walked through the door. So just having, I think that if and not to speak on behalf of anyone, but just like how traumatizing it can be to get such like culturally incompetent care, and have it just really invalidate and erase your experience as you know, as somebody who is LGBTQ plus. So just thinking, you know, it's just really important that we kind of have that affordable access to healthcare. It's extremely important for the health and wellness of our community. And then also, just on a final note, and this is not my expertise when I have two amazing, you know, reps in a room, but legislative attacks have just been horrendous, especially this session. We saw one of the worst bills, HB 198, that blatantly discriminated against trans girls and is part of a national effort to deny trans existence. But I don't need to be preaching to the choir here. But yeah, just, you know, the legislative attacks on LGBTQ AIP plus existence has just been really, really challenging to sit through and kind of see unfold throughout the session.
So I obviously we've heard some themes here around the need to educate healthcare professionals as well as our elected officials. I'm curious if any of you have had direct experience having those conversations with electeds and what those looked like, or explain a little bit about what your experience was in having a frank conversation with a healthcare professional about what your needs were. If anyone has any examples that you want to share about that, again, those are the two themes that really sort of percolated up. And I think to the extent that we have any of those folks that are here in our monitoring this panel, if there's anything that you would like to say or share with them about your experiences. Representative Cannon?
I get a lot of my health care over at Wentworth Douglas Hospital in Dover. And when I was looking for an endocrinologist locally, they had an endocrinology department, but no one there claimed to know anything about how to take care of a transgender woman.
Mm-hmm.
So in the state, at the time, there was only one endocrinologist who's over in Lebanon at Dartmouth Hitchcock. And luckily he had offices in Manchester periodically. So I had to see him on a regular basis instead of someone locally. I complained to the hospital here locally, Wentworth Douglas, and finally, over the past couple of years, they've now created a transgender healthcare unit, and complete with endocrinologists and people who are aware of how to care for transgender people. And they're also tied in with a network of hospitals, including Mass General and folks down in Boston. So they can connect people that need healthcare and surgical procedures and all of that. And Dartmouth Hitchcock has a transgender unit, and they're providing. But in between, we still need a lot more help. We need therapists for young people under 21 and their families. It's very difficult to find a therapist that'll work with a teenager, for instance. So, but we've got to apply pressure to the healthcare system to let them know what we need, and hopefully they'll come around to do it.
I just want to add, as a parent, if I may, as a gay man and as a parent to two kids, like one who was adopted and the other one that was through a surrogacy, I encounter in the state of New Hampshire a very caveman era type of view on what adoption looks like, or a surrogacy for that matter. It wasn't until very recently that the language was updated at the state legislature as to single gay men being able to adopt. At the time, my partner and I were considered single in the law, in the eye of the law. So, but anyways, going back, the first doctor we had for our kid, they didn't really recognize us as parents. Always called us guardians, which is not the language we wanted to use. So having doctors that understand family needs and language and how important that is to, especially in an adoption process, so that the families can continue to grow and evolve as they go. So that was very difficult. Luckily for us, and I say luckily because this doctor was very difficult to deal with. she retired. And so we ended up getting a new doctor for our daughter shortly right after she was born. And we ended up having a lesbian doctor. We didn't choose her. She just landed in our family. And it was one of the biggest blessings ever, because she's raising her own family and she understands what we're going through and the new things. We were asking questions as two gay men raising a daughter. There were things that we just didn't know, and that we needed to be aware of. And it was just great to have her there. So that was very important. And then in the surrogacy aspect of it, again, language is very important. So having her as our kid doctor now, I couldn't have imagined any other doctor. So that's an obstacle that we need to. Representation matters. Having LGBTQ plus doctors out there and nurses and supporting them is very important, because they're the ones that are going to be able to give us the voice to speak up for our families, and to be able to, like, when our kids are sick, when we are sick, when we need something, we will have the freedom to express ourselves, to be able to just say, okay, this is what I need. I was lucky enough that when I landed in the Lakes region, I found a Spanish doctor who was young. So therefore, he was well taught around LGBTQ issues. Is not always the case, but it was great. So him and I developed a great relationship. Then he moved out of the area. And then I ended up getting a different doctor from another country who was not very well versed in our community or issues. And it was very uncomfortable to have discussions at first about, like, questions that you may have about your health and life as a gay man. And so, those are obstacles that I've encountered here in the community. But as a parent, I cannot say this enough, how important it is to have LGBTQ doctors out there that can help us feel like we're part of the community, and that the things that we're going through is the same as any other parent, that we're just as capable and empowering us. Because that's really what doctors do. They empower us to take control of our health, to be able to make decisions for ourselves. And this is why it's so important, so devastating. I think that people are not seeing it as that way in the community, but this whole new budget that was passed, where it takes a woman's right to choose, really is taking all of our powers to choose, because in the future it will allow legislature to dictate what we can discuss with our doctors, what we can do with our doctors. So to me, it's devastating that the state is leading in this direction, because we know that when one person's rights are attacked, the next group follows. So to me, the health is super important. And to go, and I'll leave it at this, again, as I've experienced suicide in my family twice, I know that it always comes down to having this support person that has an established role in our community. And a lot of the times ends up being our doctor. So our doctor is not just somebody that is going to make us feel well just physically, but also mentally, that can empower us to say, hey, I understand what you're going through. We're going to get through this together. And they're respected in the community, and we might not be known in the community. So having that connection to them and that relationship, it just gives us a bridge into, and I hate to use the word normal, but it makes us feel a little more accepted and normal, and that we can handle this obstacle. And a lot of the times this is what young people lack, is that relationship with their doctors. And especially if you're LGBTQ plus, you might be afraid to discuss certain things. Of course, I do think that as you get older, you stop caring more about what people think. But I think it's very important that we address the fact that young people are underserved in the state in every aspect of health. It doesn't matter what it is. So, and then our LGBTQ plus community affects 10 times more. And then if you add if they're BIPOC, it's even more. So that's that.
Thank you, Carlos. Great points. Did anyone want to contribute or add anything off of or respond to what Carlos just said?
I just will respond to what Carlos said, because I have to go to a healthcare work meeting. So I just, I work in healthcare, and I work in evaluation of the study of access to healthcare services. And I think one of the points that I heard Michelle make, and others, and Carlos, is the need for appropriate care, not just appropriate in terms of the delivery of access to care, meaning you get access to it, but culturally appropriate care is something that's really incredibly important. And I hear physicians that I work with talk about that quite a lot. And some of our work in the diversity, equity, and inclusion at Dartmouth Hitchcock has been focused on just that. And it having panels like this, where those who are either in healthcare or working to advance access, it's really important for us to hear these things. So just thank you for your vulnerability and putting yourselves out there. And you're all just wonderful humans. And I'm sorry I have to go.
Thanks, Jen.
Have a good day.
You too.
And
So,
if
go
I
ahead.
could,
Yes, please.
I just want to talk briefly about having acceptance as part of our healthcare. I don't know about other people who are listening today, but my husband and I, since we have been here for 27 years in the Mount Washington Valley, have been accepted. And I said my theme in this discussion would be acceptance. And we have had primary healthcare providers who have been incredibly supportive and helped us to navigate whatever healthcare challenges we have had. And that has extended to the larger healthcare institutions, either at Dartmouth or Maine Med as well. We've got a long way to go, and especially when it is relative to issues of transgender healthcare. I think we have so much education to do, but there is a significant degree of support and acceptance in many quarters, I think.
So many of you have talked about this just in the nature of this conversation. It sort of percolated to the top around the advocacy efforts that you've been involved in. And I'm curious, so some of you had mentioned some of the more important things that you were directly working on and what needs to be done next. Are there any particular things that are as high up on the list as you could possibly prioritize in terms of what you are each individually looking to advocate for or advance related to health equity in the Granite State over the next coming year or two?
I've had a bill I've been trying to get through the past 3 years to try and make it easier for transgender people to be able to change their birth certificate information. It's like beating my head against the wall. It seems like it's a simple thing to do, but it's not. And now with the current legislature, it's near impossible. So it's trying to simplify the process so that you don't have to go to court to have a judge decide whether you can change your birth record or not. I was lucky enough to be born in Massachusetts. I got a form filled out, signed by my doctor, walked into City Hall down in Newton, and I walked out with a new birth certificate. You can't do that in New Hampshire. And from a health perspective, it really is depressing for a transgender person to have to deal with the quagmire of political stuff that they have to deal with to try and get that information changed. And it shouldn't be that difficult. You can fill out a form and get your driver's license changed. You can use that same form to go and get your passport information changed. There's a number of things, your information in the hospitals, all that stuff you can get changed, but you can't get your birth records changed and up to date. And that's been really awkward. So I've been working on that for 3 years now. And hopefully we'll get something through. The other big challenge is, not only here in New Hampshire, but in other places as well, is recognizing non-binary people. I was grateful. The first bill that I put in was to be able to change driver's licenses to add an X on our driver's licenses for non-binary people, and it passed, and it's been in effect now for over a year. The governor didn't believe in non-binary people, and the first time I brought a birth certificate change bill to him that included non-binary people, and he vetoed it because of that issue. So it's terrible. Let's put it that way.
Yeah. Well, thank you for your persistence. I mean, I think that's one of the things that as advocates, it can be really hard when you are consistently beating your head against the wall, as you've said, and eventually you do break through, but it takes a lot of time and patience and building of networks and allies and others to get in and do the dirty work with you to get things through. And a part of it is education and making sure people understand what exactly the practical issues are and the barriers. So thank you for continuing to lead those efforts, and I hope we see it again, if not next year, then the year after.
I haven't stopped trying.
Yeah. I have no doubt. I have no doubt. Others, high-level policy issues that you think you're going to be tackling or eager to work on over the next few years? Carlos, go ahead.
Sure. For me, it's two things. One is at a local level. Suicide prevention is something that is at the heart of who I am. And it wasn't until recently that I started talking politically about my personal experience with suicide and the fact that I had thought about it many times. And I look back and I say, why did I think that? And part of it is because the support network wasn't there. So as I have served on the school board before, and as I consider running for school board in the future to defeat, people like Don Johnson, who are set in making sure that they raise transgender people from our community and LGBTQ people, prevention of suicide is the most important to me at this time. In these times of COVID, on top of it, just last week, I got 2 calls from people in the community saying, my neighbor's kid came out, they got kicked out. I know what that's like. I was homeless for about 6 months because I was kicked out of my house for coming out gay. So I just relive my own pain when I see these kids in the 2021 getting kicked out of their house for just being who they are. So to me, that's the biggest goal. I would love for the state to have a specific agency addressing these issues, especially around LGBTQ. I know there are many organizations working on this, but I think there needs to be a statewide bigger effort where, we're able to network, where we're able to pull leaders from different communities and say, hey, like this person in your community needs our help. Let's laser in. So, and the other one at the national level, something that we somehow, since marriage equality passed, we kind of just, we pretended that the world just was okay. And we have to remember that not like most of the world still doesn't recognize marriage equality, and most of the world criminalizes, and in many cases, the death penalty is applied to LGBTQ plus people. I remember seeing live on TV when I was working for the Obama administration. We were all staff hanging out, and then we saw on TV this live hanging in Saudi Arabia with these 2 young men. And that image will never escape my mind. So, and I hate to make you guys all live through this, but I think we need to stop just pretending that the world is okay just because we passed marriage equality. There are still people being discriminated in our own home state. And across the world, there are still people in death row for being who they are, from Russia to Saudi Arabia to just many countries. So I think we need to work hard and use our privilege and use our platform that we have. And since 2019, when I gained a lot of momentum nationally, through the presidential loophole, wormhole here in New Hampshire tradition, I decided that I wanted to speak about these things, not just also about Puerto Rican statehood. So, my own Puerto Rico, where it has one of the highest murder rates for transgender people. If Puerto Rico were a state, it would have the highest times 10. So I think as Americans, we can do better at speaking and using our privilege and using our power that we have as a country, as people, and the influence that we have in this world. We used to call it gene influence. literally genes, but it's our pop culture, everything. We need to just be better neighbors. We need to be better people, and make sure that we don't forget our brothers and sisters that are being murdered at high rates, and nobody is reporting on these things. So any opportunity that we have at the national level, that's been my goal, to speak about these unknown names that we will never know, these beautiful faces, these beautiful people with great talents, with all kinds of skills, because our community is so diverse, that are just going unnoticed, and they're dying, and not dying, they're being murdered. So to me, it's something that we can do better as a country. And especially as a reminder to all of you here in New Hampshire, every 4 years, we get such an audience. Just think before you go on the cameras, before you go and talk to reporters about your favorite candidate, and try to use your privilege and the voice that you're using with that media to talk about these people that cannot speak up, that cannot be heard. So thank you.
Thanks,
And
Carlos.
Carlos, I think, you're exactly right. We need to extend our acceptance throughout the world. And we know that the Equality Act is something that is one step further beyond marriage equality. And the Equality Act is now in the Senate. So that's one place for advocacy for all of us. I think our senators will support it, but beyond that, how do we get it through the Senate? Because that will get us one step closer. And Michelle, I wonder what efforts are being made, and is there a way that New Futures can do health education for the LGBTQ community in a concerted way? What we're hearing today is that, we need more education in the healthcare community on a variety of issues. And to my knowledge, there are several advocacy organizations relative to healthcare, but I don't know of any organization that has a mission of continuing that education. And it would be wonderful if New Futures or some other organization could take that on as part of their mission.
Yeah, that's a really good point. And I think one of the things that there's an area for alignment, and New Futures collaborates with several other organizations. We don't want to be the voice or be the ones that are speaking on behalf of an entire community of people, but rather make the connections where they're needed to ensure that there's partnerships that are made among folks that may have not had an opportunity or just not naturally been connected to one another previously. We do a training series fairly regularly with Dartmouth residents around advocacy. And I think there's an opportunity to share what it is that we're hearing from community advocates of where there are gaps and information that residents should know about the communities that they're serving. I think that Representative Butler, I think you may have previously spoke to some of those groups. We do them in partnership with the Medical Society, but this is a great point to raise for those partners of something that should be paid attention to going forward, and a concerted effort made to highlight exactly what the issues and barriers are for this distinct population of individuals. Because it's true, you're not receiving quality care if you have physicians who are not educated in being able to competently serve you and meet your healthcare needs.
Exactly.
100% agree.
And there are some healthcare institutions that are doing a decent job, but not all. And it would be great to be able to extend it further. Yeah.
I think that partnership may be a good model to help ensure that those connections are being made and that we're fostering them in an authentic way where we really haven't before. So thank you. I really appreciate that suggestion. Finn or Alyssa? Alyssa, I see you took yourself off mute.
Yeah, I'll jump in, but I'd love to pass it to Finn right after. But I just wanted to highlight something that you just said about not speaking on behalf of any community, and just thinking about when it comes to advocacy, the importance of nothing about us without us, and really needing to see more people that are us in elected positions, in leadership roles, especially younger folks. It's really important to have role models and people that are paving the way and doing this work. I mean, Thank you. Just, thinking about how important it is to center LGBTQ plus voices in advocacy and making sure that we're partnering with LGBTQ plus individuals and communities in doing this work. Because, we know what our communities need. And I just also want to say, Carlos, thank you for your vulnerability and sharing all of that. Just not to go back too far, but as someone who's also experienced houselessness, especially tied to my queerness, just having those challenges and having to constantly be resilient as somebody in the LGBTQ plus community, I think that is just something that is just so inherent to us, is just that resilience. Sometimes it's built, sometimes it's necessary, and it's built out of a lot of trauma and things like that. But just, I'm all over the place. But yeah, I just wanted to say, Carlos, thank you for saying that. And Michelle, thank you for uplifting that as well. And thanks. I'll just say thank you again to all the panelists, but I'll pass it to Finn. I will stop now.
No worries, Alyssa. I think we're all getting a little rambly with the heat, but wow, I don't really know how to top any of that, just because everybody really covered such amazing points. But I think the thing to really reiterate is, like, get people out there who are vocal, who are a part of the LGBT plus community, and really have them be the voice for it. Because if we just have allies or people who claim to be allies being our voices, then we're not going to get what we actually need, because they're not experiencing what we're experiencing on a day-to-day basis and what we're struggling with every single day, every single week, whatever the time frame is. And bouncing way back to what Jerry said about getting the bill passed for getting birth certificate marker changed, I've been trying to do that for over a year now. It took over a year to get my name legally changed, and it took one therapy session and a letter in order to get the gender marker changed on my license. And that was really frustrating, that could be fixed so quickly, but everything else has taken at least a year to get done. So I think that is something really big that personally for me would help me, I guess, be better as a person and be one step closer to being who I really am and being seen that way legally.
Thanks, Finn. So you touched on a point that is bringing me to the final question that I have. That's a planned question, and then I want to get into some of the submitted questions from folks in attendance, because again, there are some themes here too that crop up in those questions. But you had mentioned being allies and the role of allies. And I'm wondering if you have any thoughts on what folks who are or who would like to be allies to support folks in the LGBTQ plus community and building trust and belonging. What are some steps that they can take? Are there local organizations or entities that they can support? Are there conversations that should be had with employers around creating more accepting or safe spaces, or other bills that are currently being contemplated right now, maybe retained, that could be called upon to ask for legislative support? What are some of the items that we could be doing as allies to help support and build trust within communities?
If people don't mind me speaking again, I just have one little thing that I wanted to say. I think the biggest step that you can take as an ally is not necessarily speaking for us, but speaking with us. Mm-hmm. So really letting the folks that are a part of the LGBT community really take charge and say, okay, this is what we want. This is what we're trying to advocate for. And then you as an ally kind of helping support us and back us up. And if people aren't listening to the people in the LGBT community, then speaking for us. But kind of, I guess what I'm trying to say is speak with us, not for us, unless we ask you to, I guess.
Great point. Thanks, Ben. Others?
I just want to add one thing. Having these discussions is super important, and making sure that you're intentionally making sure that your panelists are diverse. I think this is a great panel, having people of all ages. Something that I worry as I'm getting older, and I worry about where my role models are going to be taken care of, where, what nursing homes are going to like accept them if they choose to go to a nursing home, where are they going to retire, what their community looks like. So having voices that are not just young, but also older, that are able to speak to their problems, because I wouldn't be able to speak to them. I wouldn't even know where to start. So realizing, for way too often in the media out there, our community has like one image, and as the flag in the background represents, we're all colors, all backgrounds, and someone in our community might even be conservative. So I think not assuming, and just learning, as I am, when it comes to transgender issues, is something that I'm still learning, and I'm still trying to be an ally and supportive and lift their voices whenever they're speaking. I think it's super important, and having these panels, not just around Pride. Well, I recognize the month, and that's great that you're having this panel. I think we need to have these discussions year round. Holidays is a very important time to have these discussions, because it's oftentimes when the LGBTQ community is discriminated the most. When people are attending church, and some of us are left behind because maybe our religion is not really having a good relationship with our community, or maybe there's somebody who is not religious, that is atheist, and is not feeling supported during the religious holiday or whatever it may be. So I think having these discussions year round and checking in on our community and the pulse of our community is very, very important. I was just in Florida, and I cannot tell you how different our communities here and our community in Florida is. And I'm sure most of you might realize that, but I just, it's very important to check in our community, no matter what corner it is. And the further north you go in New Hampshire, realize that the chances for discrimination are higher. I have found, I hear from gay people all the time that they're like, I don't know, I'm having a tough time up here. There's not many people to talk to. So having these panels are important, because then they'll see faces. They'll be like, oh, these are people I can talk to.
Thank you, Carlos. Others?
I think on like more of a personal level, because there's a lot of ways you can be an ally, but just speaking from like what can you do on a personal level, like actively listening, positioning yourself in like cultural humility, as in like you're always in a position of learning and never assuming someone's pronouns, someone's sexual identity, their orientation, and just being really open to learning about that. And I also think that when it comes to how to be an ally, being like, I think for me, the hardest part when I came to New Hampshire, as somebody who is actually a former Floridian, Carlos, I found it really hard to find queer spaces, because it was just really hard to connect with people in the community in general. So just like, as an ally, like creating more visibility for the community, being a part of the community, and also considering too that like the fight for LGBTQ plus rights is not just the fight, it's BIPOC rights, it's disability rights. It's something that we have to be really looking at through an intersectional lens. Like even as a queer person here, I have faced a lot of, prejudice and discrimination, but I'm also extremely privileged. I'm white, I'm comfortable. I'm mostly able-bodied. So things like that, and considering that like when you are doing advocacy work, not to do anything in a vacuum, and really consider who is most marginalized and oppressed there. Collective liberation, exactly. And just in the last two, like, note that's something that's been really transformational for me, is like radical acceptance and radical love. So just really kind of approaching life through that lens and being accepting. Ed, I know you've said that so many times, acceptance, 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 and that really has resonated with me, because to really truly be an ally, you need to be accepting. So.
So I think what we've heard from everyone is a really good example of powerful storytelling, and the real need to make sure that we have individuals who are sharing their lived experience with folks who are in positions to do something about some of the issues that have been articulated here. So if I can make a suggestion to anyone who's a participant in this particular webinar, is to take the example of these powerful 5, 6 people on this panel and what they've shared with you today, and use it as motivation for your own action to use your voice, to be an ally, to lift up and, you know, elevate and bring along with you your friend who has a lived experience, and open doors for them. So again, I just want to thank our panelists for being so brave and sharing these stories. I do want to just ask a couple of questions that have been pre-submitted. One of the things that has been brought up a couple times has been around housing situations that folks have encountered, that's directly related to either coming out or, you know, potentially just finding yourself in a situation in which you weren't able to secure housing because you were discriminated against. So that is a specific question that several people actually did ask, is elaborating a bit on your housing experience and situation in your area, if you found certain areas of the state to be more problematic than others, and what resources are available within New Hampshire to help support young people who are in this situation or are facing homelessness that's directly tied to their sexual orientation or gender identity. If any of you can speak to that.
Recording in progress.
I can speak a little bit to this. I didn't experience houselessness in New Hampshire, so I can't speak to specific areas, but also understanding that, you know, in more rural areas is the least access to like things like healthcare and housing. But as somebody who has been in the position of needing help, I think it's just really understanding like there are so many ways that you can be helpful. Just something as simple as like donating a box of menstrual hygiene products to a local shelter, things like that. Or, you know, like even providing like a warm bed for a night, like things like that. And just kind of really like being a part of the community and understanding too, like how are you approaching, you know, helping people, and that like, do you actually understand the lived experience and how like dehumanizing it can be? So when you're doing like advocacy efforts, like really like to echo Finn, like do it with the people that are experiencing this. And don't, you know, I know a lot of us want to come in and be like kind of, you know, a savior in some aspect, but also like still focusing on empowering people that are in situations like that is really important, because it is really dehumanizing, like I've said. But I'd love to hear also from like a New Hampshire perspective as well.
One of the things that I have been wanting to achieve and haven't been able to over the past couple of decades is a New Hampshire-based LGBTQ organization like Equality New Hampshire, Equality Maine, Equality Vermont. If there were a central organization for the LGBTQ community, we would be able to at least have some, however few advocates who could reach out to the various segments of the community to help support those issues, including problems with housing. And I hope you younger folks will take on that challenge, because it is necessary, it is possible, and I would hope to be able to see that in my lifetime. Of course, GLSEN is a great organization for young LGBTQ people, and they are a good resource for a variety of issues, and I would think for housing issues as well.
Any of our other panelists want to chime in on this one? Carlos?
Challenge accepted, Ed.
So I'll also just add, because I am aware of an organization that is doing work specifically on homeless youth. Waypoint has a particular policy area that they are focusing on to support kids who are finding themselves in homeless situations. And this may be something that when they're crafting their programming, that we want to make sure that we're connecting them with appropriate community leaders and partners with lived experience, so that they have a competent program that's addressing these issues as well. I'm sure that this is on their radar, but in the event that it's not, I think that there's no harm, no foul in connecting them with some of our panelists and others that are participants in this webinar that want to have this conversation about how serious of a problem that this is and how they may be able to help. So we're at time. I want to open it up for any closing sort of statements or thoughts in light of this panel conversation from our panelists. Anything that you'd like for people to really take away from this conversation, and a potential action item that you would have for them. So I'll start with Finn, because Finn sort of went, I think, the last few times. So I'm gonna make you go first this time. Any closing thoughts? And what you would encourage people to do in the future?
Yeah, I'd probably first just want to thank everybody for making the effort to even be here, because that alone is an act of activism, because you're furthering your own knowledge and education on the topic. So round of applause and thank you to everybody who's here. And especially probably as a call to action, I would say look into GLSEN. My 11th grade English teacher was the chairman. I don't remember which year it was, but she was the chairman for the New Hampshire GLSEN chapter. And she also helped host Prom Out Loud, which is an amazing, amazing event that happens every single year, or except for last year because COVID. That is a LGBT safe space prom that is hosted for kids. I believe it's 13 to 20 is how old you can be. So it's for folks who even missed their own prom or weren't able to go as their own authentic selves. So I definitely look into GLSEN, look into Prom Out Loud, see if you'd like to volunteer to help that. I know that those events really helped me make friends that I still have and really provided me with an amazing safe space.
Thanks, Ben. All right, I'm gonna call on people, I think. Unless I think I hear Jerry laughing, so I'm gonna let you go next.
One of the big things we've been seeing in the legislature that we could always use help on are the negative bills.
Yeah, unfortunately.
Things that are being brought not necessarily from New Hampshire, but from all around the country against LGBT people. And I think that's something we need to be aware of, and we need to let the public know that they need to be involved to help us fight those bills, because they're vicious. It's terrible. They're attacking our families, they're attacking the individuals, they're attacking our educational institutions. So when you hear about a bill, stand up, volunteer to help, find a way to bring more people in to let our legislature know. You can't do that in our communities. Thank you.
Jerry, do you know of an organization that is actively tracking and doing newsletters or reports on bills that would be of concern that we can recommend for some of our panelists and other attendees to join a listserv so they can get these updates?
ACLU.
I didn't know if you also had your own like regular newsletter that you sent out where we could direct everyone to the site.
The New Futures is good. The ACLU is another one. They track it real close.
Yeah, Alyssa said that Planned Parenthood is also tracking them.
Yep.
Great. All right, Alyssa, because you just dropped something in the chat, you're up next. Closing argument and closing thoughts on this panel and action for next steps.
Yeah, I just want to echo everyone again and just thank you all for being a part of this discussion, because conversations like this help to destigmatize and really open up the conversation to be able to discuss a lot of this stuff. And I think, like, just speaking from Planned Parenthood, the power of grassroots organizing has been amazing to see this last session. Just the full force of people opposing these really awful bills. And championing bills that would expand protection and rights to LGBTQ plus folks. So yeah, if anyone is ever interested in getting more involved in grassroots organizing, specifically for LGBTQ plus folks, like Planned Parenthood is a great place for that, but also don't want to center Planned Parenthood in this. There's a lot of great organizations that have been uplifted as well that I would definitely say take a look into, and just, you know, listen and challenge some of these heteronormative cis normative things that you see in healthcare. You know, when you go to a healthcare provider and they ask you, are you and your boyfriend sexually active? Push back on that, and you know, even if that isn't your experience, like, you know, creating more norms around LGBTQ plus like lived experiences is really important. That's what you can do with your privilege if you have it. And just thank you so much again for having me a part of this discussion.
Thank you, Alyssa. Ed, let's go to you next.
Alyssa, thank you for noting language as being an important piece of how we help our community understand and be inclusive. I told you I'm an innkeeper, and we do weddings, lots of elopements, and just asking people when they call, who is your partner, not who is your intended husband or wife, makes a small dent in the understanding of being inclusive. Acceptance, acceptance, acceptance. We have come an incredible distance, and we have such a distance to go. And we can't sit on our laurels, and we need to do the work and continue to do the work and continue to work together. I think the idea of a statewide organization for our community is truly important and something that we need to move forward on. And that would be my action item, in addition to all the things that have been said. And thank you for including me, and thank you for joining us. This was an incredible experience. Thanks.
Thank you, Ed. And last but not least, Carlos.
Hi, I just want to say thank you. Again, anytime I get to talk with and for my community, if I can, I'm happy to do so. But this panel is people that I admire and love deeply. And along those lines that hopefully I portrayed throughout my messaging, which is love and acceptance, I'll tag on to what Ed was saying. You know, I want to address, my final thought is social media. Oftentimes we go out of our ways to focus on the negative things that are happening in our communities, that are happening in our world. And I'm going to give a challenge to everybody that is listening, including the panelists. Go out of your way to listen to somebody's story, to lift their voice. Go out of your way to be a positive influence. So anytime, you know, I realize on Twitter I have an enormous influence in the state of New Hampshire. So I try to like and retweet as many things as I can. And I know it seems like very little act of kindness, or maybe even a very artificial way. But to that person that you're liking their comment, or you're lifting their voice, or you're saying, "Hey, great job," it might mean the world. They might be in a negative thought cycle, in a depression. So that small act of kindness, it's inclusive, and it just shows that you're listening, that you care, and as small as that may be. So go out of your way to be kind and to just spread a little bit of love, because we know that the opposition is so focused on hate. So it is important that we show that there's an alternative, that there's a different way to do things, and that to have a civil discussion. So thank you again for having me.
Thank you, Carlos. And again, thank you to all of our panelists. We all have our charge now, not only leading with acceptance and love, but using appropriate language, being a supportive ally, watching and using your voice for change and advocacy. I think, again, our panelists are incredible advocates, and use them as an example for what you can do with your own voice and your own storytelling. I want to thank everyone for joining us and hanging with us a little late after 5. This was a great panel. Thank you for really putting a great stamp on the end of Pride Month, and the work continues going forward. But I really appreciate all of your time, advocacy, and I hope to see you all, leading the charge in future advocacy work at the State House. New Futures or our staff can be of support to you, or to make connections to some of the panelists. Please feel free to outreach out to us. That's one of our goals, is to be a helpful and supportive community partner that enhances collaboration among those that need to connect. So Again, we all have our charge. Thank you all for joining us, and I appreciate the time. I hope you have a great rest of your night. Thank you.
I understand.